Adam, thank you very much for coming on. Now, we know you're living in the sort of, well, everywhere in England south of me, but you're in the more southern part of England.
Yeah.
Thanks for coming on, Adam. Really appreciate it. I know you haven't been feeling great lately, and how are you feeling at the moment?
I'm still feeling quite unwell most days, but I mean the last week or so, I've started to see a bit of an improvement of my symptoms, but it's still obviously like nowhere near how I was doing before all this started. So yeah, not too bad.
Okay, so it sounds like you're putting a pretty brave face on it. I'm delighted. It's been a good week, but have things kind of been going up and down a bit? Have you ever been having good days, bad days, better weeks, worse weeks?
Yeah, it's been like really up and down. Like there's been some times where I almost feel completely recovered again, and then suddenly all the symptoms will come back like really strong. So yeah, it is really up and down, definitely.
Yeah. And before this started, you were a young. You're 22, Adam, aren't you?
I'm 22, yeah.
And you're a math student, I think, weren't you?
Math student, yeah.
Yeah. I was never a math student, but good job that some people could do it.
Yeah.
And before this, you were pretty fit. You were doing sports. You were doing all the young person's things.
Yeah, no, before this, I was skateboarding pretty much like every single day for like a couple hours a day and having like no issues at all, like with anything. So yeah.
I mean, it's how it should be at your age. You don't think about it; you just do it.
Yeah.
And you're in that category, yeah. And then let's do a bit of a timeline, Adam. What happened when?
So I got my first Pfizer dose on the 2nd of July 2021 last year.
Yeah, that's quite a while back, yeah.
Yeah. And
so that was your second dose, Adam, was it?
That was my first dose.
Oh, your first dose, sorry, my mistake, yeah.
That's all right. And so the first initial thing was having the taste of metal in my mouth, which was like happened like almost as soon as I had the shot. And
so we're talking seconds.
Yeah, like seconds after I'd got it. And at that point I like wasn't really worrying about anything, so I just thought, oh, that's probably just normal. Like, I don't know, I didn't really think about it that much. But then I do remember like asking my family, oh, did any of you guys get a taste of metal? And they were all just like, oh no, we don't really know what that's about, so I don't know.
I mean, you've probably seen the videos that we did with Nick and Kyle on this channel, and they both describe exactly the same experience, just within seconds of getting the vaccine, the metallic taste. What was it like? Was it quite a strong metallic taste, or?
It was really really strong, like bitter, like chemically metal taste. Like, I don't really know how to explain it, but
sure. It's a bit like sucking a copper coin or something like that, sucking a 2p piece or something.
Yeah, definitely, kind of like that.
So quite unpleasant. And how long did that last for, Adam? Did it?
I think that ended up. I had that taste for, I think, like the rest of the day, and then I think it started to go away the next day, and then I didn't have any of the normal like side effects, like I didn't feel unwell or anything, like I didn't feel tired. So I had like none of the normal side effects, and then this was almost exactly 2 weeks later. I was on holiday with my mum and my sister in Cornwall, and we were just like walking down the street normally, and I just randomly had this really strong feeling like I was about to pass out, kind of thing. And it was like a really intense feeling. So then I managed to get back to the place we were staying, and I just like lied down, because I thought I had like heat stroke or something, because I didn't really know what it was. So I just tried to lie down, and it kind of like slowly the feeling started getting worse and worse. Like instead of getting better, it was just slowly getting worse and worse.
That
Like,
you were about to lose consciousness.
yeah, and like my heart started like pounding out of my chest, and I was really dizzy, so like I had to stay lying down. Otherwise, like it felt like the room was like moving almost.
So if you sat up, the feeling got worse.
Yeah, yeah. Like even just sitting up a little bit, it would get a lot worse. Um, so then I was just like thought I could just sleep it off and like it was just heat stroke. And then the next day I woke up and I started feeling like my hands and my feet were starting to go numb. And
but both hands and both feet.
Yeah, both hands, both feet, like symmetrical.
Yeah.
And so then I was telling my mum and my sister like, oh, I think something like really serious is happening. And like they were trying to like reassure me like, oh, sometimes if you're anxious, like your hands and feet could go a bit numb. So like I was trying to like stay calm.
It's understandable that they didn't want anything to be wrong with you, so they were trying to minimize.
Definitely.
Yeah. Pretty terrifying for you though.
Yeah, it was really, really like I've never felt anything like it. And so then over the next couple days, the numbness like started spreading like all the way up my arms and then all the way up both my legs. And it kind of like each day like more of my arm would be numb and like more of my legs would be numb. And then yeah, it just got to the point where like my legs and my arms were almost completely numb. And yeah, that
Could you feel them, Adam, or was it? I mean, were we able to move them normally? It was just like a. Could you still walk and stuff?
Yeah, I could still move them, but it just felt kind of weird, like I was like moving someone else's arm kind of thing. And I could kind of walk, but even standing up, I was still getting the vertigo and the dizziness.
The dizziness, yeah.
So I was just pretty much in bed for like a whole week.
And we're still getting the palpitations at this stage. You could still feel your heart going sometimes.
Yeah, it wasn't constantly. I would just have there'd be small periods where my heart would start going really fast, and I'd have like some kind of like chest pains when it was happening.
Where was the chest pain, Adam?
Oh, it was kind of like directly where my heart is, kind of like there.
Did the pain kind of go anywhere? We say referred pain. Did it go anywhere?
What do you mean? Sorry.
Was it? Could you feel the pain like going into your arm or up into your neck or down to your top of your tummy?
So it wasn't like spreading. Like I would get pain there, and then sometimes I would get pain like in the left side of my jaw, and then kind of on that bit of my arm.
On your left arm or your right arm, Adam?
Always my left arm. Always my left arm. And so then, and then also when this was happening, I started getting tremors in my legs and then in my hands a bit. And I think at that point was when I ended up calling 111, and then that's when I ended up going to A&E and stuff. But yeah.
And what happened in A&E?
So first time I went to A&E, it was when I was having like a really bad episode. Like I remember thinking like I was having some sort of stroke or something, because all the other symptoms were still really bad, but then I was also like, I had like a really strong pressure like on my head, like almost like crushing inwards, and I was like feeling kind of like confused and didn't really know like I couldn't really have a conversation or anything, because I was just like, everything in my body was just like, just felt like it was going wrong kind of thing. So then I went to A&E, and I remember we had to wait for about 2 hours, I think, and like I just felt like so ill, and like I could like hardly sit in my chair, because like sitting up straight made everything way worse. And then we finally saw someone, and I think they were doing like a blood pressure test on my arm or something, and I could like, you know, when they like measure your heartbeat, you can kind of hear a beep out loud.
Yep.
But like my heart was kind of like almost like beeping like randomly, like there wasn't a straight beat to it. It just kind of, it was going like all over the place. And I think the blood pressure
So it was irregular.
I think so, yeah. Like I'm not sure really, but and also when they were trying to measure the blood pressure, like it wouldn't, for some reason it wouldn't take the measurement properly, like it kept not being able to do it. So I don't know if that meant my blood pressure was just going up and down or something, but I'm not sure really.
Did they do it manually with a stethoscope?
They were doing it with one of the automatic ones where
Yeah, but if that didn't work, did they then try and use a manual one?
No. But the guy was just kind of asking me like, do you know what day it is? Like, do you know where you are? And I was kind of struggling to even answer that. But he ended up just like saying, oh yeah, go outside and then you'll get seen by someone else in a bit. And then I ended up getting sent to, I think I got sent to like the intensive care part of A&E or whatever.
Yeah.
And then
the resuscitation we'd normally call it. Yeah, but yeah, absolutely, yeah.
I think so. And then they ended up doing like a ECG.
Sure.
And then I think at this point my symptoms had like started to get a little bit better. So then they did the ECG, and then they got back to me and they were like, your ECG looks normal, and we're pretty sure either you have heat stroke or you have anxiety. But I like knew, like my gut instinct was that this isn't anxiety. Like this felt like way worse. But yeah, that's
were you weeing normally? Were you producing, as far as you remember, were you going for normal kind of wheeze?
I think I remember I was like going like quite frequently.
Yeah.
That, like I definitely remember that being a thing.
See, if you'd had heat stroke, you'd be dehydrated and not weeing properly.
Yeah, I didn't have.
So I think that basically rules out heat stroke.
Yeah.
So quite why they would say that baffles me.
Yeah, and I mean, because at that point I'd been having these symptoms for like a week, and I'm pretty sure with heat stroke that it shouldn't really last a week.
Well, heat stroke, you become dehydrated and you run out of salt and you start feeling ill because of that. That's.
Oh, okay.
And that's clearly not what you had.
No.
So you reported the fact that you'd had these palpitations. You felt this irregular thumping heart rate, and you heard the beep was abnormal when you were listening to it. But then they came back and said your heart rate was your ECG was normal.
Yeah.
Okay.
Then I'm not sure if, because I remember when they were measuring it, the first time I was having really, really intense symptoms, and then when they did it the next time, it kind of calmed down a little bit.
So it's quite possible that you could have changed from having what we call a dysrhythmia, an abnormal heart rate, to having a normal one. That is possible.
Yeah.
The other thing that's concerned me about what you've said so far, Adam, is the pain that you were describing and where that pain went. That distribution of the pain does sound like heart-related pain. So that history alone would concern me enough to take you straight to if you came to my A&E department when I was a staff nurse on A&E, I would take you straight to the senior consultant if you'd reported that, because that would be enough to concern me. And anyway, what diagnosis did you get on A&E?
Well, my
anxiety.
Yeah, my diagnosis was basically, they just said like a combination of the two. They were like, you might have gotten heat stroke and then that made you feel anxious, and now this is just anxiety or something. They basically said they couldn't find anything, so that's like the only thing they could say. But they didn't really do any more tests or anything. They just said.
But you'd reported to them that you'd felt the worst you'd felt in your life.
Yeah.
And they basically wrote that off as anxiety.
Yeah.
Well, I am so sorry that happened. I mean, to use a psychological stroke psychiatric explanation when you haven't exhausted all physical possibilities, to me, is one of the most fundamental mistakes you can make in medicine.
Yeah.
Because you knew it wasn't anxiety, and from what you've described to me, even though we're only on a Skype call, I know you're not just describing. Obviously, you're anxious as a result of this.
Yeah, definitely.
Obviously, it sounds terrifying. I'm shaking just listening to you. But to go through that, you clearly know the difference, and you're clearly a lucid historian. You can tell the difference.
Yeah.
So what happened after that? So that we're in about. So 2 weeks after the vaccine, the symptoms started. About a week after that, you went to A&E.
Yeah.
How did the time after that go?
So after that, it kind of like, this is when I was kind of like thinking like, oh, could this be a reaction to the vaccine or something? Because I think
you'd started reading about it at that time.
Yeah, and I was just thinking like, it doesn't make any sense that they're saying I have anxiety when my symptoms are way worse. Like that didn't really make any sense. And
I mean, just before we go on, I mean, I'm quite happy to admit, Adam, I've had anxiety episodes.
Yeah.
And it is just awful. But I didn't have those. And I was a psychiatric nurse. I've worked with a lot of people with extreme anxiety.
Yeah.
And this just doesn't sound like anxiety. The cardiac distribution pain doesn't sound like anxiety. The palpitations and the irregular heart rates certainly don't sound like anxiety. And particularly because if you're anxious, your heart rate will be high, your blood pressure will be high.
Yeah.
So why would you go dizzy when you stood up and when you sat up? That's completely, that you're describing what you're describing there is a cerebro hypoperfusion event. That when you're standing up, the blood's not going to your brain properly. That's just not an anxiety feature that I can relate to, or that I've seen in many anxious people that I've worked with. So it sounds like to me you're describing an organic, biological condition, and that's clearly what you were feeling.
Yeah, definitely.
So in the week after A&E, what happened then?
So after that, it's just like the symptoms kind of just stayed like really, really severe. The numbness was kind of like just stayed the same, like it wasn't getting any better.
So at this stage, it was both arms and both legs?
Both arms and both legs, yeah.
Did it go into the body, into the torso at all, or did it kind of stop at the top of your legs?
It went like a tiny bit it was like below my belly button. Like it never got up to my belly button. And then so my symptoms kind of just stayed the same for a while. But then the tremors started getting quite a lot worse. So they were getting more intense. And I was starting to have like almost like episodes, almost like twice a day, where my symptoms would get really bad. And then I think, oh yeah, then we had to come back from holiday because it got so bad. And I think I ended up going to A&E another time because it like just wasn't getting any better. And then
what happened at that visit to A&E?
pretty much the exact same thing. They just said like you really need to see like a psychiatrist or a psychologist and get prescribed
So
like anxiety medication.
again, they're attributing what you and me believe to be completely physical symptoms as psychological.
Yeah.
And then worse than that, Adam.
Yeah. And then this was the time as well when I was having quite a lot of trouble just walking properly, and the nurse that was seeing me was like, "Oh, can you walk properly?" And then I was trying to walk down the hallway and I was like going really slowly, like it was really obvious, and she just said, "Oh, but you can still walk, so you seem fine." Yeah. And then so like they were just making it out like I was really anxious and that I don't know. I don't know.
Again, you seem to be minimizing it. You were complaining of symptoms and they were yes-butting. Yeah, yes, but you can.
Yeah.
And
that's as well when I was having like quite bad tremors in my legs where they were shaking, and the nurse was saying like, "Oh, it's all right, like you can relax now, everything's fine." And I was like I couldn't control what my legs were doing or anything. And yeah, so then it was basically the same thing. They just said you need to like get treatment for anxiety and stuff, and then I just got sent home, and that was pretty much it.
I'm just trying to remain calm here, Adam, because what you're telling me just outrages me right to the very core of my body. But if I get mad, it won't help the communication. But I'm feeling it. So this is taken as what? So into mid-August now?
I think at this point it had been like 3 or 4 weeks of having like really bad symptoms. And then this was when I saw there was a video. I think I watched a video on Instagram of a girl. I think her name was Georgia Rose or something. And it was a video of her saying, "This is what happened to me after my Pfizer vaccine." And it's a video of her like shaking and like not being able to walk properly. And it was like pretty much the exact same symptoms I was having. So I was like started to put it together like, oh, maybe I'm having the same thing. And then she ended up saying the best way was to see like a neurologist privately, because she had the same experience where doctors were just dismissing her. So then I ended up seeing a private neurologist and had an MRI scan to like rule out any like brain damage or anything. And so then I ended up getting diagnosed as having functional neurological disorder, I think it's called.
Yeah.
But then even then I thought like the neurologist was like quite quick to kind of diagnose me as having that.
Were you still getting the chest pain at this time, Adam?
I think I was getting it, like it wasn't that strong, but there were times where I was getting chest pain, definitely.
Yeah. I think we should just say functional. A functional condition is one where there is no identified biological correlation. So it sounds like what he's done is look at the MRI scan and say it's normal, which is great.
Yeah, definitely.
But you're still getting these neurological symptoms, therefore it's functional. That seems to be the way his thinking was going.
Yeah, I think
but as you say, that you seem to arrive at that diagnosis fairly quickly.
Yeah, and then I think I remember I even brought up like, is there a chance this could be a reaction to the vaccine, because the symptoms started so close to when I'd got it. And then he said something like, the chance of you having a reaction to the vaccine is like 1 in a million, and then the chance of you having a neurological disorder is like way more common. So then he just kind of said he didn't really think that could be it, but I don't really know.
Anyway, he didn't seem to follow that one up. Yeah. So another disappointment from the medical system for sure, and you had to pay for that, for goodness sake.
Yeah, quite a lot of money.
It's terrible.
Yeah.
Should have gone straight through on the NHS with that severity of symptoms as an emergency referral.
Yeah, so weird.
And what happened after that, sort of into autumn time?
So then I think, so my symptoms, that's when as well I started getting like some weird like vision issues. So like I was seeing like quite a lot of like flashing dots and stuff, and like my vision would kind of like flash white and then go back to normal sometimes. And then but then as well, the numbness in my legs and my arms started to go away, so that started to get better. And I think I got prescribed a medication called propranolol, I think it was called.
That's what we call a beta blocker. Slows the heart rate down and things like that.
And then I was did
that seem to help him?
So I was taking it for like a week or two, but like it almost felt like it was making it worse. But then the neurologist had told me like, oh, this should make the symptoms better and they should just go away on their own. But then like I kind of felt like it was making me feel more ill, kind of thing.
The propranolol seemed to make you feel worse.
Yeah, like it was just making me feel like really sick.
Again, that actually makes quite a lot of sense, because what the propranolol would do, it limits the ability of your heart to pump out blood as quickly. So given that your heart probably wasn't working properly anyway, for example, if it turned out from your symptoms you did have myocarditis, and from the pain and the dizziness, it does sound that's a serious possibility. The propranolol would further suppress the activity of the heart, making the heart pump even less efficiently, and thereby reducing the blood supply to your brain, and that's what would make you feel worse and make you feel dizzier. So you had to stop taking that after about a week.
And then basically since then it's just been like I've basically been in bed most of the time, and such like the tremors and stuff like started to get a bit better, but then they'd all come back, like get worse again, and it was just like I ended up having a period where I almost felt like completely better for a bit, and then that's when I ended up going back to university for like, this was at like the start of term, and I went back for like 2 weeks.
So this is September-ish.
And then I just remember I was back for 2 weeks, and then I randomly just started getting the dizzy feeling again, and I remember like sitting in a lecture and like trying to concentrate on what they were talking about, and like I just felt like really ill again, like almost like I felt right at the beginning, and then it all just kind of came back, and then I ended up having to get like picked up and then come home, and then it kind of just all started again, like all the same symptoms, and then yeah.
So was this the start of your second year?
Yeah, this was meant to be the start of my second year.
So you bounced through your first year, and then the second year just became an impossibility.
Yeah. And then
nothing intrinsic about university, because your first year you did that as normal. That was fine.
Yeah, that was fine.
Yeah. And then what about over winter, Adam? How did that go?
So
well, we're still there now, I suppose.
yeah. So I think it kind of like basically I was just having like all the same symptoms, and I was basically I was pretty much in bed like all the time for quite a long period of time. And I was
through tiredness or dizziness or
just because like I just felt so like ill, like, and like even just getting out of bed to do anything would make the symptoms like 10 times worse. So, and I don't know, I like didn't really know what to do at that point, because
you were stuck. Yeah,
like all the doctors are saying like, I don't know, like it should just go away on its own, but then it was just like not getting any better. So I just, yeah.
So all the doctors were wrong.
A little bit, yeah.
No, quite a lot by the sounds of it.
Yeah.
Were you referred to a cardiologist, Adam?
So I was. Oh yeah. So basically, this is when I kind of like, I ended up making a GP's appointment, just like a normal GP appointment, because. Sure. Oh yeah, I remember I started. At this point, I was starting to get quite a lot of shortness of breath. So like, it would like I'd be breathing normally, but it felt like I like wasn't getting enough oxygen or anything. So I made like an emergency GP appointment. And then that's when, so they like measured my heart, listened to my breathing and stuff, and they were like, I think my heart rate was like 140 beats per minute, and then my blood pressure was like 170 over 110 or something like that. And
both exceptionally high for a young fit guy like you, exceptionally high.
Yeah, and she just kept asking like, are you 100% sure like this isn't anxiety? And I was like, yeah, 100%, like this has been going on for so long. And so then I think she was also really confused, like how I'd been to A&E so many times and they hadn't tried to do any more tests when
this
I had like
GP.
Yeah, like she was like seemed quite angry.
As indeed am I.
Yeah. And so she thought like I could even have like blood clots like in my lungs or something, or like I can't remember what it's called, pulmonary
embolism.
Yeah, like she thought I might have something like that. So then she got me to do some more like blood tests, and I had a chest x-ray, and then everything came back completely normal. But then she said like she wanted to refer me to a cardiologist, but that it could take like up to like 8 months to end up seeing one. So then we ended up just seeing a private cardiologist.
At least your GP took you seriously.
Yeah, that was like, and I'd already been having symptoms for like 5 months at that point,
It must have been quite reassuring to have a medic actually listen to you and believe you.
Yeah, definitely.
The first time after 8 months.
Yeah, like she was probably the first like doctor that was like, yeah, this does seem a bit weird. Like yeah.
I think that's one way to put it, Adam.
Yeah. Yeah.
And you saw a cardiologist?
Yeah, I ended up seeing a cardiologist. This is like quite recently now, because it took quite a while to organize it all. And I had an ECG and then an echocardiogram. And the cardiologist said everything looks normal except for the fact that your heart rate is like 140 beats per minute, and that was like
not normal.
No, like yeah, and like that's when I was like lying down as well, so I was like quite relaxed. And I think he was saying like it could be POTS, I think it's called.
Yeah. So this is the postural orthostatic tachycardic. But basically it means your postural orthostatic tachycardia syndrome, I guess. So, so basically it means your heart rate just goes really, really fast when you stand up.
Yeah, yeah.
And that's what was happening. Your heart rate was going even faster when you were standing.
Yeah, so like it's weird because my heart rate, even when I'm lying down, is still really high.
And that's still the same now? Your heart rate's fast now?
Yeah, like because I have like a
finger doodah.
A thing, yeah, you clip on your finger.
Yeah, peripheral pulse oximeter.
Yeah, and the other day I was literally just like brushing my teeth and started to feel a bit dizzy, so I was like, oh, I'm going to measure my heart rate, and I think it was going from like 150, and then I saw it go up to like 160, and then that started to like freak me out a bit, so then I just like lie down, and I'm pretty sure it still does that, but I'm kind of like don't really want to measure my heart rate anymore because it's just weird to see it.
Well, it's more than that. It's terrifying because it's kind of. So your heart rate's going high when you get these dizzy episodes, so I think we can say that the dizzy episodes are caused by the episodes of tachycardia.
Yeah, I think so.
So did the cardiologist indicate a way forward?
So the cardiologist, I ended up having like a 24-hour heart monitor put on.
24-hour memo, yeah.
And then he prescribed me ivabradine to like.
What do you know what that's for?
It basically just slows your heart rate down. And he just prescribed that, so like he still says like he doesn't know what the problem is, but like I might as well take that to lower my heart rate in the meantime. And then he still hasn't got back. Like I think I've got another appointment.
Are you having to pay for the second appointment as well?
I think so. I'm not sure. I'm kind of like splitting all the costs like with my parents and stuff because they're trying to help out as well.
Well, of course.
Yeah.
But you're still talking about a lot of money here that the NHS really should be looking after you. This is so disappointing. So you're kind of waiting for the cardiologist to get back. Is this new drug seeming to have any effect?
It's helping a little bit, I think, but like I'm still having like all the same symptoms, but it is helping a little bit, I think. Yeah.
Are you still getting the pain?
So I haven't had the pain in like 3 days, but like a couple days ago I was getting it quite badly. Yeah.
Does the pain respond to any particular painkiller, Adam? I guess you've tried the usual thing. You've tried ibuprofen, paracetamol,
and. No, I don't think it gets any better. for anything like that.
Okay.
Yeah.
So you're still in limbo, basically, aren't you? Kind of waiting to see what this cardiologist says and unable to resume your university career.
Yeah, pretty much at the moment. Not good.
It certainly is not a good situation.
Mm.
I mean, is there any talk of referring you to anywhere else? A long COVID clinic or something like that?
Well, I mean, like, none of the doctors have said anything like that, or like they haven't really said like what I should do.
I mean, not this is caused by COVID, but it seems to be that sort of area of.
Yeah, like I think like there's definitely like quite a lot of similarities between long COVID and whatever reaction this is, but.
Have you knowingly had COVID, Adam? You never.
I'm almost 100% sure that I've never had COVID, because when my symptoms started, I initially thought, oh, this could be COVID related. So I was doing like lateral flow tests every single day, and they were always negative. And I was around my family the whole time, and none of them had COVID at that time, so I don't really think it would be to do with that.
But obviously your doctors have done an antibody test.
No, they haven't.
It's just that they haven't.
No.
So your doctors haven't bothered to find out whether you've had COVID or not?
No. Like they've told me to get like certain blood tests, but they've never done an antibody test. Like I didn't even think to even ask to do that, like, because I've just been.
Well, why should you? You're the one that's suffering.
Yeah.
Objectively, when I'm suffering, and I've worked in healthcare all my life, there's no reason why you should be able to. It's not. So it's very much a wait and see situation.
Yeah, I think so. Definitely.
Well, I wish there was something I could say to guide you forward, but I think we'll wait and see what's happening, aren't we? It's right. Adam, this is a syndrome that quite a few others have been describing.
Yeah.
And watching this, I suspect many others will recognise, as you recognise Georgia Rose, who was courageous enough to publicise that. And
yeah.
You're courageous enough to publicise it, and many other people will relate to that, and hopefully this is going to help us get towards the stage where this is recognised for the biological syndrome that I'm convinced it is.
Yeah, definitely.
So we certainly appreciate it, Adam. Is there anything else you feel that you want people to know about?
I'd just say, like, if you have the same thing, like, try not to worry too much, because I think there were points where, like, I was like almost certain like I was gonna die because it felt so bad, but then I haven't. So if you're going through the same thing, like, just don't worry too much, kind of thing. Like, I have gotten a bit better as time's gone on, so yeah,
but I think we'd take medical advice immediately.
Yeah, definitely.
If you have any of these features, do not delay seeking any medical advice that you're going to need in that situation.
Yeah, definitely.
Adam, so it's really good of you to come on, and it's not easy talking about your suffering. And I know I mentioned a couple of minor things I've had, and it's quite actually hard to do it. So
yeah,
what you've just done is a remarkably courageous thing, and really it is. It's a very, very hard thing to do. but it's one people are relating to, and I suspect you're going to see that in the comments.
Yeah, definitely.
So, would I mean, anytime you want to come back and update us on your condition, Adam, please do.
Yeah, definitely. Yeah, like, thank you for having me on as well. Like, I didn't really expect you were gonna reply or anything, but yeah, cheers for having me on and everything.
No, it's you're the one that's suffering. It's your nobility that's allowed you to share this. We appreciate it, and
yeah.
Let's talk again. But for now, Adam, to say I wish you well is trite, but but I'm not quite sure what else to say, to be quite honest.
Yeah.
I'll just say one thing to healthcare providers: pain is what your patient says it is, existing when they say it does. And most of them know that. I think you maybe had a bit of a bad sample, but if we don't believe our patients, then why bother taking histories? Adam, thank you very much.
Cheers.
Thank you.